Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program and henceforward for the next week or so, we'll be having special speakers who participated in the CINI conference which was held recently to talk about their experiences and also their focus on integrative thinking. Integrative thinking is coming up in a big way, and Canada-India Network Society along with the Harpreet Singh Show every second Tuesday of the month while we talk to you on this particular important topic. But for the next week, we will be focusing on all the speakers as to what do they think, how can integrative thinking be helpful for the common people. So today we have Dr. Arun Garg, the founder of CINS, and Dr. Manjunath from S-VYASA University, who will be talking about their experiences and about their views on integrative thinking. Dr. Garg and Dr. Manjunath, welcome to the program.
Nice to be with you, sir.
Thank you very much.
Wonderful to be back with you.
Thanks, Dr. Manjunath. So before we start, Dr. Garg, just a brief introduction about Dr. Manjunath.
Yeah, it's a pleasure. But before we do that, as you know, today is Canada Day. So I'll be remiss if I don't wish everybody happy Canada Day, because it's Canada-India Network Society. We celebrate August and January for India, but this is Canada Day. So on that auspicious day, warm welcome, Dr. Manjunath. Dr. Manjunath is a pro vice chancellor of S-VYASA University. He is a dedicated researcher on the whole notion of integrative thinking. If I may say, Harpreet Bhai, S-VYASA University, under the direction of Dr. Nagendra, who been our guest, and he is both Dr. Manjunath and Dr. Nagendra are on the International Advisory Committee of Canada-India Network Society. So we have a very positive collaborative relationship. I think they have really made the word integrative medicine real. And that's what I like about, and that I think is a phenomenal contribution Dr. Manjunath and Dr. Nagendra has made in the field of integrative medicine. And obviously we have introduced the notion of integrative thinking, and this is what our conversation will be. So warm welcome to Dr. Manjunath.
Thank you very much for this brief introduction, Dr. Garg. And Dr. Manjunath, your topic on which you spoke basically was yoga as the foundation for integrative medicine. So we would like to know, and apart from that, you were a co-chair of this conference and you heard many other speakers, which we'll later on focus upon. But regarding this particular subject, what you talked about, if you could share your views about that and which can be helpful to the common public.
Wonderful. Thank you very much, Harpreet ji. First of all, happy Canada Day to everyone from India. So this is the most appropriate show probably because Dr. Arun Garg has brought India and Canada through this Canada-India Network Society. And it's an opportunity for me to wish all those who are attending this program in Canada a happy Canada Day. So it was a wonderful conference and we had such amazing speakers. And I was asked to talk about using yoga as the foundation for integrative medicine. The whole focus was on integrative thinking. So then, of course, when we look at integrative medicine, integrative thinking forms actually the backbone of this formation of integrative medicine. So it was most opt theme, whatever has been chosen for this conference. And we always felt that when you want to really actually bring multiple healing systems together for providing a better clinical outcome to a patient, what is needed is something should actually bind, something should actually connect all these different systems. Of course, conventionally, we look at the modern medicine as the platform on which we bring all other systems because this is the most evidence-based and present day, the benefits of conventional medicine is very understood. At the same time, looking at lots of limitations because of which the non-communicable diseases, what we are looking, have been increasing. And that's where we try to bring in the concept of integrative medicine for Number one, as a preventive healthcare strategy. Number two, as disease management strategy. When we look at yoga, in particular, we have lots of those commonalities which can fit into many of the other systems very well. When we talk of these non-communicable diseases, one thing comes to our mind is lifestyle related issues. So the two factors, stress and lifestyle, have been identified as the major culprits for the increasing incidence of non-communicable diseases. So when we talk of yoga, it is not the physical posture, it is not just the breathing, what we call in pranayama, or it is not just the meditation or relaxation techniques. It's a combination of them on one side. Also, along with that, in yoga, we bring in other kinds of lifestyle medicine, particularly the diet part of it. We talk a lot about the kind of food, what is suitable for different personality types, and what is not suitable in case of disease conditions. So food is and diet is one part, then physical activity second part, then how best you can manage your habits is the third part, and number four, your basic fundamental rejuvenating mechanisms, including your sleep. So how yoga can actually knit them and actually make them better with respect to bringing a better lifestyle is what I was trying to bring together as the basis for actually using yoga as an adjuvant therapy along with conventional medicine. Lots of scientific studies are there to suggest that yoga probably can be used along with allopathic medicine, along with Ayurveda medicine, along with Chinese traditional Chinese medicine, or any other system of medicine, because there is no conflict. So because what it adds is what is already not there in other systems of medicine, and what is most relevant for present day issues, which are stress and lifestyle related disorders. So as I was mentioning, little more than 8,000 publications are there, research papers are available today, out of which we are very happy to say that majority, up to 40% of these publications come from the studies on non-communicable diseases. So that means there is a decent amount of evidence available for us to say that when you use yoga along with conventional medicine or any other system, the results are much better than using one system. So we also bring in the concepts in a much simpler way, and also at times as per the requirement of the individual, because what happens is today we treat the disease, not the individual. We treat actually the symptom but not the cause. So having said that, this particular methodology is going to change this, and the whole approach was actually make it a personalized medicine, actually bring in an individual to the center and the problems associated, the cause of the problem to the center. If you remove the cause, then probably the symptoms and the disease can be reversed. So that's what we discussed in this whole session, along with many other wonderful speakers.
Wonderful, absolutely, you're very true that the amalgamation of the best of the East and the West, that can produce wonders, and that is what is required. Stress, depression, tension, all this is increasing in the world in a big way, and if we incorporate these kind of thoughts in our daily practice, then definitely it will be a different lifestyle what we'll be living. So Dr. Manjunath, while you focus on this particular aspect, you listen to other speakers also. What do you feel when conferences of these kind are held? This 3-day conference was a grand success, we know. Speakers participated, and I'll talk later on with Dr. Garg as to what recommendations are they coming out from this conference, because it's not just organizing one thing, but the next step is most important as to how to use those thoughts into further practice at the local level. So what is your observation, Dr. Manjunath, because you listen to all the speakers, as to how these kind of conferences can play a very important and dominant role in disseminating and further implementing that kind of information?
Very true. Particularly the session which I co-chaired was an amazing session. So at the same time, I had the opportunity of participating in few more sessions. The speakers in particular were of who's who in their own fields. So I was getting tempted because in my session we were giving people around 5 to 7 minutes to give an introduction and then to have the discussion. You don't believe each talk was equivalent to a keynote address. So probably it would have gone for 40 to 45 minutes.
Right.
And people represented like one side, be it the SFU, on the other side UBC, on the other side you also had policy makers. So I mean, I had such a wonderful opportunity of listening to Dr. Mark Pelletier, Samantha Tong, Dr. Karen Davison, as well as Dr. Vidhi Thakkar, as well as Brendan Byrne. So what was something common in all these presentations was actually taking this understanding of disease management little beyond the present day's understanding. Each one of them focused on the ability to reverse a condition like diabetes. So otherwise what we think is once a diabetic, you are for life you are a diabetic. You have to keep popping pills. So this presentation, this session has actually changed this perception. When you actually bring multiple thoughts, it is not just the medicine part of it. There were such wonderful presentations where they were talking about South Asian community and how you can involve them, how you can bring a change in their diet habits, how you can bring a change in their lifestyle. And that has brought in a change in their disease severity. So we generally don't think, as medical professionals, we always think that my duty is only to give medicines. But these presentations actually change this perception that at a community level, you can bring the change. So you can actually make everybody involved in this, the policymakers involved in this, then you change this perception. So that's when I felt it was a beautiful theme, integrative thinking. So that's what something what I have observed, and the question answer sessions were also amazing, right, because there were too many questions, but we had very less time, and I'm sure you are going to take all those questions forward to people who ask these questions through this show.
Absolutely, Dr. Manjunath, as you have very rightly said, and all the speakers are coming, and we start off today with you and Dr. Garg, and we have all the speakers talking in details as to what their thoughts is and as to how we can incorporate this kind of thinking in the system as such, because still there is some hesitation. It will take time, but congratulations to you, S-VYASA University, and Canada Indian Network Society for coming forward and talking on these things so that the common people also can be involved at the ground level and they also play a part, and we have some better deliberations and better results. Dr. Garg, congratulations once again. I've already told you so many times, we are really, we've been influxed with calls from people after the show which I did with you. And people really want some change. They are fed up now of the kind of thought that has been put into their mind, especially in the Western world. But now with the bringing forward, of course, the importance of the Western medicine cannot be sidelined. But when we bring in this kind of integrative thought, people are coming forward and they are willing to accept because they know that the kind of lifestyle they have chosen is leading them to some other kind of results. So, Dr. Garg, if you could sum up the conference, because you were present in listening all to the speakers, and if from all this conference you have come out with some recommendations also.
Yeah, thank you very much for that very challenging question, because I think that is the essence. But Harpreet Singh, let me just reaffirm, because our listeners and viewers must be wondering what is this all about. And as I said, the meeting, some people might say, where is the meat? But I say, where are the veggies? We are really into proper diet. Right. So I think there are certain values for which we are driven. And I think to focus, and I think even in today's show and every show you'll be playing on and beyond, there will be a participation and a message of the individual. So I think one of the key things we are bringing forward is that we need to engage the community as a whole, and community includes the family, community includes the friends, community includes the elders, community includes the doctors, community includes the healthcare providers, all working towards the same cause or lowering the disease.
Mm-hmm.
And even though we are talking about chronic diseases, or even though we are talking about many chronic diseases which have the same common pathway, but to stay focused, we are identifying diabetes as the uh, main disease entity uh, from the conference. And we are saying, first of all, prevention of the disease, health promotion of the disease, and most important, when the disease is there, reversing of the disease.
Mm-hmm.
And that's really the essence of our purpose now for next 2 or 3 years from Canada Indian Network Society. First thing we are doing is we are collaborating. There is no one person who can do this. So you have many conferences, people come and they speak and then they go away. Our conference is different. All these people who are speaking are our partners. They are our collaborators. For the first time, as far as I can make out in British Columbia, we have major educational institutes all coming together along with the ministry, along with Fraser Health, the biggest health authority with the largest South Asian population, along with the help of Provincial Health Agency and other health authorities. So I think one thing I want to take some credit for Canada India Network Society, that our mode of operandi is to bring people together, collaborate with the outcome focused objectives. So that's a very key point I want with Dr. Manjunath with us for people to know, because Canada India link is to fulfill the other half. And Harpreet Singh ji, I'm so happy that after 10 years search, Canada India Network Society in last 6 months have landed on its feet. We have a full collaboration with the biggest, the premier institute in India of integrative thinking, integrative medicine, S-VYASA, along with Dev Sanskriti University, and we are also exploring in All India Institute of Medical Science, integrative medicine. So I think through this network, we are connecting with the people who believe that there is a problem, let's solve it.
Mm-hmm.
The other point I want to make from the conference, and Dr. Manjunath can expand on it because he has spent all his life, where is the evidence? Where is the research? So anything we do is evidence based and is fusion of the East and the West, but it's a not mutually exclusive. So we are not saying that this is better over this. What we are really saying is that let's synergize to fill the gap. And that leads me to my next point, which is the key point, that our focus is to identify the gap through the power of integrative thinking and work on that gap. We are not here just to do more of the same. So as already said, the pharmacotherapy, the interventional external therapy, all done in traditional Western medicine, is very good. It's here to stay. But we want to add to where the gap is.
Mm-hmm.
And gap is at the individual level and at the community level, people engaging in their own health. Once either whether it's health promotion, whether it's illness prevention or disease management, we want to take it to the next level so that people are fully engaged. And this is where Eastern thinking comes in. Yoga philosophy is so engrossing in engaging the individual, as Dr. Manjunath so aptly described about 5 different koshas and how an individual gets more attached and more involved in their own care. And I think that's the area we're going to work on. That's the area we're going to bring people together. That's the area where we're going to put our energy. And we have worked very hard to put all those dots and connect them.
Right.
And happy to share more with our viewers, but I do want to stay focused in terms of our key message for our viewers is
Mm-hmm.
that chronic diseases big role is played by you and your community.
Right.
And let's all work together to fill that gap.
Absolutely, that's very true. And Dr. Manjunath, as Dr. Garg has pointed out about the evidence-based thing, there is still some hesitation. And when it comes to evidence, could you elaborate a little bit on this?
Yeah, certainly. See, when we look at the evidence, there is no end to it. Okay, so as many publications we can bring in, and because it's always a situation. So we have worked a lot on COVID, but it's changing again and again. So we are learning a lot by doing scientific research. Even in chronic diseases, there's lots of attempts have been made to generate evidence, particularly when you bring in integrative medicine, and also in particular, I would like to emphasize on yoga. We always think that yoga involves some asanas, pranayama, meditation. So it's all external. So what is happening in the body, we don't know about it. So probably it's all just a kind of an psychological feeling. So what in modern day understanding, we call it as a placebo effect rather than the original true effect of yoga. But we have done enough studies, particularly emphasizing on diabetes. In one study, we have demonstrated that if you give yoga to individuals and measure their insulin uptake capacity using a euglycemic clamp, it has demonstrated that the insulin sensitivity increases in individuals who practice yoga. So one of the biggest issue in diabetes is there is insulin resistance. So insulin resistance in the body and finally leading to insulin resistance in the brain. So what we are trying to bring in is actually activate those channels in the body which are in a way blunted and then activate them. Another study we have done to look at, imagine in couple of individuals, the beta cell activity in diabetes will be very low, even up to 80% of the beta cells won't be functioning. So what yoga demonstrated is, even if 20% of your beta cells are functioning, yoga will empower those 20% of your beta cells to produce enough insulin to manage your diabetes, manage your basically the sugar requirements. So that way there are lots of these studies which have gone into the underlying mechanism to explain how probably yoga can actually bring in this change and how we can reverse these kind of conditions. So as I was mentioning, little more than 8,000 papers are there today in the world, and you will be happy to note that out of which a little more than 850 papers have been published by this one university in India. Wow. So that is S-VYASA University. So we hold a little more than 12% of world literature on yoga.
Wonderful.
So this is not just talking about one condition like that, but this is spread across multiple chronic diseases. So today we have enough evidence to say and explain the underlying mechanisms, how probably we can help them to manage and help them to reverse if possible.
Oh, that's really commendable, the kind of work which is being done by S-VYASA University. But on the other hand, the rest of the time I would like to focus now on self-management, because the future is on self-management, and that's what Dr. Garg also has been always emphasizing over here. And he's famous for his 5 things: kab khate ho, kitna khate ho, kyun khate ho. And the question is the eating habits, the lifestyle that we have adopted, whether it is the West or the East. And India also we see the same trend, especially amongst the youngsters. So Dr. Manjunath, what would be your recommendation to the common people as to how to start incorporating this kind of thinking in their daily life? Because once the kind of food also that we eat, and gone are the times when we used to work hard, do labor work. It's more now mental work, just sitting and working. So seeing all this, if we could share your wisdom as to what recommendations you would like to give to our viewers watching this program all over the world.
There is a standard prescription, we say, which comes from the yogic lore. Before that, I will tell one much more common observation. We tell many people, observe animals. Many of us might have maybe having pets at our home. So they teach us a lot, particularly with respect to eating habits. Okay, So whenever they are their satiety feeling is taken care, even if you feed them, they don't eat. So starting from there, there is a very standard way of describing what has to be eaten, how much has to be eaten, and when to eat and what not to eat. So the problem with us is uh, suppression. Okay, so everybody wants to eat a pizza, everyone wants to eat a burger, everyone wants to eat all that fried stuff, and that satisfies our tongue. But what happens to the body, knowing that it is not going to be useful for us, we continue to do that. So it is said very clearly that when you eat, have to fill the one third of your stomach with a solid food, one third of your stomach with liquid, and one third of the stomach with any other what it satisfies your taste, and leave that remaining one third for air. Unfortunately, many times what we do is we fill it so much that forget about air, and it will be to our neck. Right. So second thing is in Bhagavad Gita, it is so well said about three different types of diets. Okay, food what you can consume: sattvic diet, rajasic diet, and tamasic diet. So food can also make us like that. Our personality can be influenced by what food we take inside. So tamasic is what actually makes us feel dull, while rajasic makes us very active, while sattvic is which is going to give us that balance kind of it. So whenever we are trying to have a plate of food, so ensure that it is filled with lots of vegetables. So generally what happens, we have 1, 2, 3 katoris of vegetables, and rest of it is you have parotas and rice and many other things. So when we give the prescription, we tell you just reverse it. Okay, so have this rice and other things like in katoris, and have as much of boiled and raw vegetables as possible in your plate. That is going to actually help you to bring in this kind of a change. And number most important thing is when you eat, what is your mind state? I mean mindset. So how mindful are you when you are eating? How thoroughly you are actually enjoying your food, and how participative you are is also important when you do this. People have some misconceptions about food, like you should not eat a lot of rice, you should eat a lot of rotis and other things. Honestly speaking, it is totally dependent on the region. It is dependent on individual personality. It also depends on what exactly is needed for that person. So otherwise we make at times some mistakes. So of course I can keep talking about diet and food, but this is in brief right, to mention about what is good for people.
Right. And Dr. Manjunath, are these kind of thoughts that you are sharing available through the university also in the form of courses which people can join and learn more as to how they can become in charge of their own health?
Yeah, these courses are actually designed in such a way that we have the best blend of East and the West. So one side we have all these concepts from the Eastern wisdom, whatever I was talking about, be it from Upanishads or yoga texts, etc., what concepts have been spoken for self-management. On the other side, what kind of evidence or scientific proofs and evidences available for us to understand this better. Every course, be it a simple 1-month certificate program to a 3-year undergraduate program, or a master's program, or a doctoral program, in each one of them is we have the best amalgamation of the theory and practice. It is not just reading, but also for them to experience, to bring a change. Our founder, Dr. H.R. Nagendra, is very particular in actually demonstrating when somebody joins a course, at the end of 3 years, when you get out of the course, what changes have been noticed by an individual is recorded. So be it at their personality, their autonomic status, their health condition, mental health, several of these are monitored to demonstrate that this course has actually brought in a change in you as an individual, and then you have learnt a lot whereby you can contribute it to your family and to the society. So this is the overall thought.
Excellent. And which website can people go to and find the course which they want to join?
Our the full name of the university is Swami Vivekananda Yoga Anusandhan Samsthana. In short, we call it as SVYASA, S-VYASA or SVYASA. So the website is svyasa.edu.in.
Okay.
So svyasa.edu.in gives you all the details about the programs as well as all the latest updates in the field of yoga to anyone who is interested.
Thank you, Dr. Manjunath. Dr. Garg, in conclusion, what would you like to say?
Well, I think just to add to this, what we'll do is we'll take it even one step further. So on our website, we have now people who attended the conference, they can stay in touch with us. And we will be working with S-VYASA to have tailor-made courses which they already have, especially in the realm of filling that gap and complementing with the effort we are doing here. So there is some synergy, and we will like people who attended our meeting to stay in touch with us through our website, and we will provide more information, and we will even make it easier for people to enroll and register in some of these courses through our website. So I think, Harpreet, we are really trying to make it as practical as possible.
Right.
Now, you asked a very, very interesting question, which I think CINS is determined from day one, and that is engaging the community. So we are working towards establishing community base for this kind of capacity. Self-management is very popular, but what we are talking about, precision medicine-based self-management for South Asian population. And we are hoping that we could have a program if we could get the funding for it, which then will allow people to come together and then see whether it works or not. Interestingly enough, there are about 6 or 7 very meta-analytically based studies which show that self-management in South Asian community is most effective when it's done as a community rather than as individuals. Because we have our own culture, and our culture is very community oriented, very family oriented. So we're going to try to repeat that in Fraser Health and try to work that. So that's one of the recommendations from the conference, and that will be our work for next 2 or 3 years. As you could imagine, these things take a lot of work. But one message is very clear. As a biochemist, medical biochemist, as a physician of 40 years, we do need to bring change in managing diabetes so that the individual is more involved in this integrative approach of the total care of diabetes. So pharmacological therapy is important, but behavior modification, lifestyle is as important. So we're going to try to work towards that. And I think that was the essence of the conference.
Right.
And there is a lot of evidence for that. It's a challenge. It's a culturally has to be effective, culturally has to be efficient, because it's individually. And as Dr. Manjunath said, the learning from Vedic philosophy is that it's precision medicine. And I am taking a course, the S-VYASA right now, and I did submit myself to personality test. And guess what? Even after one course, I have enhanced my qualities by 20 points.
Right.
By 20 points. So I have evidence now. Pre-test, post-test.
Right.
And I think that's what it's all about.
Right.
For personal satisfaction, empowering yourself to feel good about yourself.
Absolutely.
Using health as the medium. So
Right.
I think that's a course Canada Indian Network Society is now embarking on. We're grateful to our partners. We are grateful to our collaborators. And S-VYASA University is the premier partner in this journey. And we are really looking forward working with Dr. Nagendra. We all call very call him very fondly Guruji, and Dr. Manjunath, and hopefully we'll get local universities engaged in it now. That's our next step. And when that happens, then we will try to bring this thinking in our training program. So that's will also help. So I think we're trying to be as composite, as comprehensive as possible, and still stay focused. So our focus is chronic diseases, focus is diabetes, learn from the post-COVID, and empower the individual.
Great.
So that's really what our journey is.
Excellent, excellent. And Dr. Manjunath and Dr. Garg, thanks for initiating these kind of dialogues and reaching out to the common public, because generally most of the time this remains confined to the think tanks only, and it is very difficult for the common person to understand the kind of thought which further comes. But reaching directly to the people through the media and other forms of talks is really appreciable. And thank you very much, and best wishes. And once again, happy Canada Day to all our viewers. And Dr. Manjunath and Dr. Garg, thanks a lot for your time.
Thank you.
Thank you very much.
Welcome.
Thank you, Dr. Manjunath, for joining us.
Absolutely.
Okay, bye.
Thank you, Gargji.
Thank you. So as we listen to both these think tanks as to what the research is doing and how we can play our part, one thing we would just want to emphasize that this is not a medical advice. If you are facing any issues, please consult a physician. And secondly, the diabetes, when we talk about it, is the type 2 diabetes. So please keep that in mind, but take your health into your own hands, and let's be mentally and physically fit. So our guests today, Dr. Manjunath and Dr. Arun Garg, who talked to us on an important topic about the CINI conference, which was held from June the 18th till June the 20th, in which participants from all over the world, the West and the East, participated and shared their views as to how integrative medicine can play an important role. As we talked before also, and in the next few days, we'll be having various speakers come forward and share their wisdom as to what they think, what is required today. And ultimately, as Dr. Garg pointed out, that it all comes upon us as to how we take this information and start implementing them. They are providing us the tools. The CINS has played a very important role in this. S-VYASA University is, this institute is well known all over the world for the kind of research that they have done, and as Dr. Manjunath also pointed. So they're doing their part, but now comes our part, how we need to start incorporating all this thought in our daily life and free ourselves from all the kind of negatives in health, physical and mental, what we are facing today. So once again, we would like to thank these organizations for coming forward and including us also. And again, thank you to the viewers for sparing their valuable time and being a part of this journey. So once again, happy Canada Day. Enjoy yourself, stay healthy, enjoy yourself, and see you soon.